Hello, my name is Alyssa. I'm a nursing student at Lenore Ryan. Is it okay with you if I do an abdominal assessment on you today?
Yes.
All right, so have you had any pain or any issues with your abdomen or any history of pain or issues?
No.
All right, have you had any abdominal surgeries?
Nope.
All right, so first I'm just going to take a look at your movement. I can see respirations. I don't see any palpations or peristaltic waves, which is completely normal. You can't really see that in people. So next, I'm going to take a look at your contour. You look like you have a flat shape and your stomach contour is symmetrical, which is good. Next, I'm going to take a look at your skin. You look like you have a nice light pink color. I don't see any abnormalities, just a couple of moles, which is completely normal. And next, I'm going to check your umbilicus, which is your belly button. And it appears to be midline vertically and horizontally. It is inverted, and I don't see any abnormalities there or any umbilical herniations. Next, I'm going to take a look at your muscles. So if you could just pick up your head for me. All right, I'm going to check your rectus, your inguinal, and your femoral. And I don't see any herniations there, which is good. Next, I'm going to auscultate your stomach just to listen to your sounds. So I'm going to start in the right lower quadrant. All right, so I heard about 7 bowel sounds in a minute. I heard the gurgling sounds and they were high pitched, which is completely normal, and I didn't hear any abnormalities there. Next, I'm going to take a listen for bruits, and I'm just going to check your aortic, your renal, your iliac, and your femoral. I'm going to come this way to check your femoral. All right, and I didn't hear anything there, so that is completely normal, no abnormalities. Next, I am going to percuss your stomach, just listen to what it sounds like. All right, so I don't hear any abnormalities there. I hear tympanic sounds over the air and dull sounds over your organs, which is completely normal. Next, I'm just going to percuss your gastric air bubble right along this midline. And that sounds hollow all the way across, which is normal. Next, I'm going to percuss your spleen. So I'm just gonna walk my fingers down to your 9th through 11th intercostal space. And I hear a dull sound over your spleen, which is completely normal. Next, I'm going to palpate. So I'm gonna start with light palpation. So just let me know if you feel any tenderness. Any tenderness in the lower right quadrant? Any tenderness in the upper right quadrant? Any tenderness in the upper left quadrant?
No.
Any tenderness in the lower left quadrant?
No.
Okay, so I forgot to percuss your liver. So I'm going to go back and do that right quick. Luckily, I haven't done any deep palpation, so hopefully we can still hear everything. So I'm going to start at your 5th intercostal space and work my way down. Alrighty. And then I'm going to work my way up from the bottom. All right, so the diameter of your liver is about 6 centimeters, which is completely normal because the mean diameter is 6 to 12 centimeters. So to continue on with my palpations, I'm going to now do deep palpations. With your light palpations, you didn't have any tenderness, and I didn't feel any, starts with an M, give me a second. Masses. Okay, so now I'm going to deep palpate. So I'm just going to do a dipping motion. Any tenderness there? Any tenderness there? Any tenderness there? Any tenderness there? All right, so no tenderness, didn't feel any masses, no abnormalities there. So next I'm going to palpate your spleen. So if you could take a big deep breath in for me. All right, and I can't feel your spleen, which is good. That means it's not enlarged. Did you feel any pain there? All right, so next I'm just going to check your right kidney. So if you could take a big deep breath in for me. All right, do you feel any pain there? All right, I can't feel your right kidney, which is completely normal. Take another big deep breath in for me. All right, any pain there? All right, I couldn't feel your left kidney, which is completely normal again. So take one more deep breath for me. I'm gonna check your liver. Any pain there? All right, and your liver feels normal. So that completes my assessment for today. Is there anything else I can help you with? All right, have a great day.
Thanks.
Did I miss anything?
Good.
Hi, my name is ALYSSA, and I'm a nursing student at Lenore Ryan. Is it okay if I do a musculoskeletal and neurological assessment on you today?
Yes.
All right, so upon just looking at you, you look like you're dressed for the weather, you look nice and put together, and your speech seems normal, which is good. I'm first just gonna start with immediate recall. So I'm gonna tell you 5 numbers, if you could just say them back to me after I'm finished. So 3, 7, 6, 2, 1.
3, 7, 6, 2.
Great job. And then I'm going to do recent memory. So I'm going to hand you 3 objects. If you can just tell me what they are.
Mask, nail polish, and remote.
All right, so I'm going to put these out of your view, and then I'm going to ask you what these 3 objects were later, okay?
Okay.
Okay, so next I'm going to do your remote memory. So what's your mom's maiden name?
Ocean.
Perfect. All right, so I'm just gonna go through a thought process scenario with you. So if you're walking in the mall and somebody in front of you dropped their wallet, what would you do?
Pick it up and get to it.
All right, that's a great appropriate response. So upon already looking at you again, your emotional status seems normal. You're not crying or being overly laughy or anything, which is great. Next, I'm just gonna ask you about your activities of daily life. So can you sit by yourself and stand by yourself, walk?
Yes.
Can you feed yourself, bathe yourself, brush your teeth, brush your hair? All right, perfect. So next I am just going to inspect one of your joints. So if I can see your wrist. All right, any tenderness there?
No.
All right, so upon looking at your wrist, I didn't see any atrophy, contractures, bony enlargements, redness, nodules, and swelling, and you don't have any tenderness, which is great. So next I'm just gonna check your olfactory nerve. So if you could just close one nostril for me and breathe in. Other side. That's good. And then I'm just gonna grab this candle over here, and if you can tell me what it smells like.
Good.
Is there a specific smell?
Just ocean.
Okay, that's good. Alright, so next I'm going to check your optics. So we've already done this, or we would do it again, but for acuity we would use a Snellen eye chart to see how many letters you got correct. And then for your visual fields, we would check your 6 points. Yeah. So next I'm going to check your oculomotor, your trochlear, and your abducens. So if you could put a bridge up on your nose, usually I would have a pen light, and I would shine it in this eye and make sure that your eye contracted, and shine it in this eye and make sure that it contracted, and that would be direct. And then to check consensual, I would shine a light in this eye and make sure this pupil contracted, and then the other way around. So that's good as well. And then I'm going to check accommodation. So just look at my finger. All right, and your eyes converged and accommodated to my finger, so that is great as well. So now I'm going to do your 6 points of gaze and check for nystagmus. So just follow my finger. Sorry, I'm moving a little fast. All right, so no nystagmus node there, which is great. So next I'm going to check your trigeminal. So if you could just clench your jaw for me, and I would try to open your lip, but I don't want to come too close. So your temporal and masseter muscles are strong, which is good. So next I'm going to check your sensory branch. So I am going to touch you with this, and this will be light touch. And I'm going to check you with this, and it'll be pain. So if you could close your eyes for me, I'm going to check your face, and if you could just tell me if it's light touch or pain.
Okay. Light touch. Light touch. Pain. Pain. Light touch. Light touch. Pain. Light touch. Pain. Light touch. Pain. Pain.
All right, that's great. Everything looks good there. So next I'm going to look at your corneal reflex. I'm not actually going to check that, but what would happen is I would get a cotton ball and move it close to your eyes and see if you would blink. So hopefully you would blink. And next I'm going to check your facial nerve for symmetrical moves. So if you could raise your eyebrows, smile for me. Great job. Frown. All right. So your facial movements are symmetrical. So next I'm just going to check your muscle strength. So if you could blow up your cheeks for me like this. Good. And then if you could stick your tongue on your cheek. All right, your muscle strength there is good too. So next I would check your acoustic nerves. So I would do a whisper test, a Rene test, and a Weber test. Next I'm going to check your glossopharyngeal and your vagus. So if you could swallow. All right, that looks symmetrical. If you could stick out your tongue and say, ah. All right, your uvula movements are symmetrical. And then if you could, I would check your gag reflex, but I don't want to make you gag today, so we're not going to do that. And then upon just listening to you, your voice doesn't sound hoarse or anything, which is great. So next I'm going to check your spinal. So if you could just shrug your shoulders for me. All right, look left and right. All right, and then shrug your shoulders. All right, so your trapezius is strong, and then look that way and try to look this way. Oh, that's good too. Other way. Perfect. So your sternocleidomastoid and your trapezius muscles are strong as well, which is great. So next I'm going to check your hypoglossal. So if you could just stick out your tongue. All right, I don't see any tremors there. And then if you can move your tongue up and down. Yeah, side to side. All right, that's great as well. So next I'm going to check your motor cerebellar. So point-to-point testing. So if you could just put your arms out like this, touch your nose. Great. Close your eyes. Put your arms back out. Don't hit the wall. There you go. and put them back on your nose. Perfect. Okay, so next we're gonna do your rapid rhythmic alternating movements. So if you can pat your leg. All right, if you could do fingers to thumb, great job. And then if you can flip your hands, great job, and tap your toes, perfect. Next, we're gonna do your motor non-cerebellar. So if you could just grip my fingers for me, perfect. Seems even and strong. If you could do your Romberg, so we're gonna stand up. All right, close your eyes for 20 seconds. I'm gonna check to see if you sway or anything. Perfect, I didn't see any swaying movements, so that's good as well. So keep standing. If you can walk this way, your gait seems normal. You don't walk with a limp or anything abnormal. And then here, if you want to come back in front of your chair, and then if you could walk on your heel to heel like this. Perfect, everything seems normal there. And then if you could walk on just your heels. Perfect, and then just your toes. Perfect. And then if you could hop on one foot. Great. Other foot. Great job. Okay, so next I'm going to check your spine. So if you could just bend over. I don't feel any deviations or any abnormalities there, which is good. If you could bend front and back, side to side, twist. All right, so you have good range of motion. You can take a seat again for me. If you can hold out your arms, I'm gonna try to resist my pushing. Good strength there. And then if you could hold up your legs, try to resist. Great job. Good strength there as well. So next I'm gonna check your sensory system. So I'm gonna do the same thing with light touch and pain. So just close your eyes and tell me which one you feel. Check your legs, if you move your hands. All right, that was good. So I didn't see any abnormalities there. So next I'm going to check your vibrations in your fingers and toes. So usually I would have a tuning fork. I would strike it on my hand and I would place it on your fingers and you would say if you felt the vibrations or not. And if you feel vibrations, that's normal, and I would do the same thing and I would strike it on my hand and put it on the most distal joint on your toe and see if you felt vibrations. So next I'm going to check discrimination. So the first one is stereognosis. So if you want to close your eyes, I'm going to hand you two objects, and if you can just tell me what they are. Before we do that, I'm sorry. What were the three objects I asked you to remember at the beginning of the assessment?
A mask, a nail polish, and a remote.
Perfect. Okay, so close your eyes. I'm going to hand you two objects. Let me know if you know what it is.
Nail polish.
Yep.
Remote.
Perfect. So that, your stereognosis is good. So next I'm going to test your grypthesia. So I'm going to draw a number on the palm of your hand and you're going to tell me what it is, okay? You don't know?
No,
Okay.
do this here. 4.
Okay.
8. 9.
Perfect. Okay. So next we're going to do point localization. So I'm just going to touch you and you're just going to touch the exact same spot I touched.
Okay.
Perfect. Okay. So next we're just going to check your reflex functions. So we're going to start with your bicep, and usually I would have the little thing. So you just rest all of your weight in my hand and I would tap you right behind your elbow and we would see a little bit of a movement. And then I would check your tricep. So I'd smack you right here, see a little flex in your hand. Next, I would check your plantar. So we are going right below your knee and you would kick like that. And then check your Achilles. So I would hold your foot and tap right here and we'd see your foot. And then I said plantar, this is patellar. Sorry about that. But your plantar, I'm just going to go towards the outside of your toes and around, and normally you would see the toes curl. But that completes my assessment for today. Is there anything else I can help you with? All right, thank you.